Organisation has made a general recommendation that manufacturers of this H1N1 influenza vaccine use what's called oil in water adjuvants. An adjuvant is a so-called helper for the immune system. It hypes up the immune response. And the oil and water adjuvants are based on a lipid called squalene. Now, squalene is naturally present in cell membranes. Being injected with vaccines with squalene as a component have also been linked to Gulf War syndrome. Any of the H1N1 influenza vaccines could be incredibly harmful and have the potential to cause serious long-term illness.
Would I be able to get your comment on this banner here?
No thanks.
Did you know that the swine flu is man-made? Yeah, because it's actually been spliced together with 4 different strains of flu. It's got 1 avian flu, 1 human flu, and 2 swine flu actually attached to it. And all the people that have come sick down in the US, none of them had any contact with pigs. And supposedly the FDA is going to be releasing the vaccines without actually testing them properly to see whether or not they're safe for the public. And the US has just brought in about $967 million worth of vaccines, and our country's brought in 300,000 jabs as well. It's actually really serious. As a member of the media, what do you think their responsibilities? I am. Tell us a little bit about the Baxter vaccine and the swine flu epidemic.
The New Zealand situation is that the Ministry of Health here has ordered 300,000 doses of a swine flu vaccine manufactured by Baxter. Now that's enough for 150,000 people. And the people they'll be targeting first are the so-called first responders. Now those are frontline healthcare staff and also police and other emergency services personnel such as firefighters. If a quarter of the 150,000 people plans to have a swine flu shot, the first responders, even if a quarter of those people developed an autoimmune disease as a result of being vaccinated, that would not only be devastating personally for them and their families, but the social welfare costs and the costs to the health system and then the police and the emergency services in terms of no longer having highly trained personnel available because they were crippled and sick themselves would be immense. The fact that the New Zealand government has chosen to use Baxter shows, in my opinion, very poor judgment on the part of the Ministry of Health.
The flu itself was concocted up in a lab and released so that they can dispense toxic vaccines in order to reduce the population. Are you aware of this?
Yes, I am. It's been the stated aim of various people in the elite for years now. That sort of history of using vaccines basically is sort of bioweapons. You have the potential to devastate the population by causing an epidemic, literally, although it wouldn't be contagious, as far as I know, probably only the people who are injected. Such a huge burden of severe autoimmune disease in the population, you would have societies no longer able to sustain themselves.